Medication safety is a central element of nursing practice, requiring both theoretical and practical knowledge. Medication safety is a routine but complex intervention, and errors sometimes have serious consequences. This scenario is set in a hospital. The NOM Amelia has become aware of a recent medication error which has occurred on the ward. The NOM gathers the nurses from the ward for a meeting in order to discuss the issues at hand. The NOM will be using a transformational leadership approach to discuss and implement the strategies for change with Alex, the senior nurse, Pramila, the new grad nurse, and the clinical nurse educator, Amandeep.
Hello everyone, how are we today?
Very good, thank you.
Okay, that's good. So the reason for today's meeting is to discuss the medication errors and the medication safety. This is the second time that a medication error has occurred in the last 4 weeks. I'm not blaming anyone as mistakes can happen in the workplace, although this should not be repeated as it may lead to a fatality of one of our patients. We must all come together now and discuss reasons for change and how we can overcome the issues. How can we prevent medication errors and ensure medication safety? Does anyone have any ideas?
So I believe one of the main reasons for medication errors in this ward is due to insufficient staff on the floor. Because there's insufficient staff on the floor, we're not really focusing at the task at hand. So the standard of care drops. Since there's a limited time, I believe that there's added pressure towards us nurses to complete the tasks for the patients. I believe as well that this is when medication errors can occur and patient safety decreases and becomes compromised.
Okay, so I'm just gathering from what you were explaining that more staff is required to prevent these certain errors from happening. Are there also any other problems or issues that are in the ward that you want to discuss?
Yes, I have noticed that nurses, especially new grad in particular, require more education session, meeting and in service, as sometimes we are not fully familiar or confident with the procedure and policies of both the ward and the hospital. There are constant changes regarding patient care, patient safety, medication administration, medication safety policies and guidelines. Due to lack of knowledge of this thing, error can occur.
Okay, yes, I do agree with that. But I'd also like to mention that we have a great clinical nurse educator, Amandeep. She puts up regular notices on the board regarding updated policies and procedures.
Hi guys, if there is any problems regarding any procedures and policies, please don't hesitate to page me or ask me any questions. I am here to help.
We have some new grads on board. However, I feel like sometimes they lack the knowledge in regards to the procedures and policies of the ward. Do you guys have any suggestions in regards to help us?
So if you see any other nurses struggling with the workload or requiring assistance in any way, try to help out each other as much as you can. Because working together in a team, we can prevent medication errors and promote patient safety to ensure we provide optimal care. New grad nurses, as well as all of other nurses, they can look at policies and procedures and can utilize tools such as MIMS and CEAP to help with medication administration. You can also seek assistance from myself or the educator, and we may be able to help. If there is an issue with workload, we can try reallocating patient loads, such as pairing the new grads with the senior nurses.
I agree with what Amalia is saying. We need to incorporate the use of educational tools such as MIMS, CEAP, and the injectable handbook. As the educator for this ward, I will always be here to assist you in any way. It is important that we all work as a team to ensure safe outcomes at all times when working and caring for patients.
Yes, at the end of the day, we are a team and we need to help each other out as best as we can, especially with the new grad nurses. In regards to the insufficient staffing, I will try to work with management to see whether it is applicable to have more nurses on the floor. To address the medication errors, you have to make sure you must always go back to your nursing fundamentals of medication administration. So this means ensuring the 5 rates are always correct and double check with another nurse. However, if you still lack the confidence or you need any help, please seek to myself, senior staff, or the clinical nurse educator for any help. If there are any problems, also don't hesitate to ask me.
In conclusion, the staffing meeting was a success. The NUM used a transformational leadership style in order to discuss and overcome errors in the workplace. There was a need for a change, and this was addressed by a leader who encouraged staff members to make a difference. Strategies were discussed and will be put into place so that nurses in particular hospital setting can avoid making errors in the future.